Hi, Dr. Praveen Mereddy, Senior Consultant Orthopedic Surgeon at Star Hospitals, Nanakaram Guda. So today we are going to talk about hip fractures in general. As you know, the hip involves the ball and the socket. So today we are going to concentrate on the ball part and the proximal femur part. So here the fracture can occur around the head, or what we call as the neck, or the trochanter, or below the trochanter. The common fractures which we come across in the elderly age group are between what we call as the intertrochanteric fracture, that means between the greater trochanter and the lesser trochanter, or involves the intracapsular fracture neck of femur, where the capsule is still covering the whole joint. Now the fracture can also occur here on the head. These are rare, but we'll talk about these two injuries. These fractures occur more commonly in the elderly. The intracapsular fracture neck of femur can occur in a high velocity injury in a younger patient also, and the treatment for that is what we call as osteosynthesis, wherein we try to preserve the femoral head and the neck by fixing it. So especially if somebody is below 55 years, we tend to fix them, but above 55 we tend to replace them. In the replacement there are two options, what we call as we replace the ball alone, or we replace the ball and the socket. Now younger and active patients, we try to preserve the head, but if we cannot, we have to salvage it, then we go for total hip replacement, again using what we call as a ceramic on ceramic or the ceramic on plastic bearings. Coming to the fracture fixation, there are intramedullary devices, that means a rod which is put in inside the bone, or extramedullary devices, that means a rod or a plate which is put on outside the bone. So both work well, and they take 6 to 8 weeks for these fractures to heal. The intracapsular ones take longer time to heal if we are fixing them, but the additional risk of loss of blood supply to the femoral head is always there when especially it is intracapsular. So these are the disadvantages of fixing them, but natural head is much better than any artificial joint, so we tend to try and preserve the head in a younger age group. At Star Hospitals we have excellent rehabilitation and physiotherapy department with good nursing care. Thank you.